Why should a patient come to your office for whitening when there are over-the-counter products for this purpose?
One of the problems that we have with the conventional over-the-counter white strips is that we have a concern about consistency and color uniformity throughout the individual tooth and throughout. It actually is not just from tooth to tooth, but it's within the individual tooth. Sometimes parts of the tooth are darker than lighter, and there are humps and that you have to kind of work over to get the outcomes that you need. Now, I monitor this for my patients. I follow it closely so that if it takes 2 or 3 different iterations to get the outcome that we're looking for, that's great. In addition, if we don't do these various iterations, we may not be able to get truly the uniformity that we want on a tooth-by-tooth basis. That's one part. The other part, which becomes very significant, is that oftentimes I'm dealing with patients who have old restorations in their mouths. And then there's an issue with the continuity of color and form. But in this case, when we're talking about bleaching, we're talking about color specifically. And if I whiten the tooth up to a certain level or brighten the tooth to a certain level, then I've got to change the restoration to match these, because restorations in their own right do not bleach like the natural tooth structure may. There's also a third concern, which is the fact that certain colors work not as well in terms of bleaching as other colors of teeth or shades of the tooth structure itself. So a tooth that may have a gray-brown understructure may not bleach up to the same level that a tooth that has a yellow or pinker coloration within, or a tooth that may have a brighter, more sparkling potential to achieve this brightness that we're talking about. So every situation is different, and I have to be able to monitor this for my patients to be sure that we get the kind of uniformity that we want in the end for all concerned. So rather than have the patient go ahead and actually perform these treatments independent of the dentist, I see it as kind of this collaboration. The patient's going to work at it at home, but I'm going to be monitoring it every time the patient comes back into the office until we get that color value and hue and chroma that we want to match more closely to the natural teeth.